Now it's time for our mental health moment. May is Mental Health Awareness Month, with nearly 1 out of every 4 adults reporting some form of mental illness. Knowing which number to call can make all the difference in getting the right kind of support when you need it. We're joined today by Sweetser spokesperson Justin Chenette to tell us a little bit more, to help us break down the difference between all of these resource lines, which can be confusing, so very important. So Justin, when Mainers need access to various mental health recovery services, what line should they be looking to?
Well, you know, it can be a little intimidating to access the behavioral health system when there are so many different phone numbers and different things, and particularly different programs and services. So you might know you need help, but you might not know what are the different acronyms and different programs available. That's where the Promise line really comes into play. It's 1-800-434-3000. I feel like there should be a little jingle for that, but basically that puts you in touch with our access team, and they'll really assess where you're at in your particular journey, what are the challenges that you're struggling with, and then connecting you specifically to programs and treatment options tailored to you in your area, in your region, breaking down what's available now and what might take a little bit of a wait to get into a particular program or service area. So that's a great starting place if you're like, I just need help and I don't know where to go.
Okay, great to have someone to help walk everyone through that.
Yes.
So what should people be calling? And I think I know the answer to this, but it's always good to remember, what should people call if they need immediate help right now?
Pop quiz 988 is the number you should know. 988 is the mental health version of 911. This is a national suicide and crisis hotline. This essentially replaces a long crisis line that we've had in the state of Maine. So no matter what state you go to, 988 is the number that you want to remember, and you can text or call that number. So maybe you or someone around you is having thoughts of suicide or self-harm. Maybe you're spiraling and going down a very dark path, feeling a strong sense of hopelessness, and just feeling like you just need immediate support from a professional. That's where this number comes into play. So you text or call that number, you'll be in touch with a trained counselor. They'll assess whether or not you're safe in that moment and those around you are safe, and then they'll figure out, do they need to put you in touch with a local provider like Sweetser, where we'll dispatch potentially a mobile crisis team out to your location. We're actually the largest provider of mobile crisis services, so maybe we need to help de-escalate the situation and then connect you to longer term supports.
Okay, really important to know that one, 988, and great to hear that you can text as well. That's
Absolutely.
Really good to have that flexibility. So if people haven't reached that crisis point, but they do want some sort of help, maybe it's more long-term, maybe it's down the line, where should they be looking?
I love the peer support line. It's free, it's 24/7. We had over 38,000 calls to that line just last year alone. We get thousands more every single year. People are really relying on it. Number one, it's free. We like free resources. But number two, there's a lot of service deserts in Maine where you might not have access to behavioral health services. So this free support line might be your only lifeline for behavioral health care. And so it's not initially clinical. It's about individuals with lived experience sharing in a sense of community and connection. So these are trained professionals to have mutual conversations. They've been there, done that. They've either had a mental health or recovery challenge themselves, and then can basically be there to listen and understand from a non-judgmental standpoint. So the average phone call is like a half an hour. We do definitely get frequent callers to the line, and just to know that someone's there for you, and to listen and to be understanding and to not judge you in your journey is so critically important. So that peer support line is really there for you in your moment. Maybe you're in a rural area and you don't have access to services. Maybe you're a senior and you just need someone to talk to. This is a great line for you.
Oh, so great. Well, Justin, thank you so much for joining us. This has been so helpful in this Mental Health Awareness Month.
Absolutely.
Justin Chenette from Sweetser.
Thank you.